Everett, interesting trial was presented this year at ASCO. It's called the PRONOUNCE trial that actually I think partly addresses what Karen raised. It was PEM-carbo alone versus pac-carbo-bev. So really two of the most popular regimens that are probably used in the United States. And it had a very unusual endpoint. It was called G4 PFS, basically progression-free survival without grade 4 toxicity. What's your take on both the results of the trial and actually the design of the trial?
So the question of the trial, I think, is important to ask, does the doublet, because in its own phase 3 trial, I think the median survival was about 12 months, compared to the triplet, that's taxane-based, which also in ECOG had a median survival of about 12 months. So knowing between those two, is there a difference, I think is important. PRONOUNCE falls short of answering this. So for us to know the answer is important. PRONOUNCE shows no statistically significant difference in survival, although the trend is a little bit in favor for the triplet. And so we really can't say from PRONOUNCE that they are the same, but it suggests that the difference would be very, very small. Now that endpoint then is one that seems engineered toward the benefit of pemetrexed. And so it pronounces either grade 4 toxicity or progression as relevant endpoints. And what it showed was that by that endpoint, the pemetrexed arm was numerically a little bit better, whereas if you looked at just progression-free survival, the triplet was a little bit better. And so it does flip in the favor of the pemetrexed, the interpretation of progression-free survival. And the cynic in us would suggest that that was done on purpose and that this was a cleverly designed endpoint.
It was really, in some ways, a marketing trial and not really trying to address a critical survival question. Anne, your thoughts on the trial? Criticisms or
well, I have to agree with Everett. I think the primary endpoint, it's not a validated endpoint. It's not one that we've typically seen in any of the other studies. And so I think, there was a lot of criticism for this study for that reason. I do think, though, it was comparing to two regimens that a lot of us use in the clinic. And so it didn't show any new safety signals. And so I think, the trial is what it is. But did it really give us anything in terms of grade 4 PFS being a great endpoint to use to go forward with? I don't think so.
In retrospect, it was probably ill-designed. It should have included grade 2 and 3 toxicities that were that would have clinically affected the patients. It did not factor neuropathy or some other taxane-based toxicities, and frankly, if it included that, it might have been positive, which is ironic considering how it was designed. And nor was it powered really for either PFS or overall survival
it wasn't
benefit or
correctly,
for non-inferiority.
Right, and I think it's always dangerous when you're mixing around with the endpoints, incorporating toxicity profiles along with, radiographic resist measurements. I think that we have a problem with that.
So a intriguing but controversial trial that can really generate a number of different perspectives. I want to turn now to